I'm just so fucking tired. I'm actually tired. Like, I'm actually tired. What I hate about sickle cell is that because they don't see what sickle cell feels like, they underestimate how much pain we're in. And it's just draining. Like, you have to fight for your right everywhere. Like, even when you don't feel well.
Imagine being in the worst pain of your life and the only place where you can get treatment is also the same place where you experience racism and discrimination. This is the reality for a lot of people who face sickle cell.
I knew something was wrong with me, but I didn't know I had sickle cell anemia. I would just randomly have pain in my back, or my legs would give way, or my arm would give way, and I can't play PE today. But I didn't know why. My mum didn't have a sit down with me explaining to me what my condition was. I didn't know anyone experiencing this same illness as me. And I didn't quite understand it myself.
I've suffered with a condition called avascular necrosis, which is bone death, and I needed to have both sides of my hips replaced, and going to also need my shoulders doing.
Sickle cell is very challenging, and we're trying to make awareness for other people to know how to help us.
Donating blood is the key. This awareness day, held at the African Caribbean Centre in Leicester, aims to encourage more people to donate.
It's important to encourage people who come from the Black African and Black African Caribbean communities to come forward as blood donors, because there's a particular need from those communities. Their blood is the most helpful and useful.
The message is going out there to people, and we hope that many people will come out and register themselves and test their blood type and start to donate blood to save lives of many people.
So I knew something was wrong with me, but I didn't know I had sickle cell anemia. I would just randomly have pain in my back, or my legs would give way, or my arm would give way, and I can't play PE today. But I didn't know why. My mum didn't have a sit down with me explaining to me what my condition was. I didn't know anyone experiencing this same illness as me. And I didn't quite understand it myself.
Know your limits. You have to know what you can do and what you cannot do. You also have to take into consideration things like the weather and all of that.
It's a common feeling for people who have sickle cell anemia. They say that the pain that they feel when they're in a pain crisis can be described as giving birth.
Walking with like blades attacking your bone. There's a stigma attached to sickle cell, and a lot of people don't feel comfortable talking about it because of the lack of knowledge surrounding it.
Sickle cell is one of the most common diseases. However, there is a lack of awareness around it, which highly affects patient care.
Healthcare professionals just think that we are just there for the drugs. We're drug seekers. We just want to feel high and then go home. But that's really not it. Knowing with sickle cell on a daily basis is hard. You have to know your limits. You have to know what you can do and what you cannot do. You also have to take into consideration things like the weather and all of that. So living with sickle cell is not all bad. It can be good as well. One can still have a fun life. One can still be adventurous, but you have to do things within your limits. I believe that as an adult with sickle cell, you would have known your limits over the years when you were younger. So it would be easier to live with. It involves taking my medications. I have to take my morning medications, my night medications, and if sometimes I have afternoon medications, I take that as well. Again, I don't do too much, and I space things out. So maybe I have to do 5 things. If I can do 2 today, and I do 3 tomorrow. Just learning not to do too many things at once.
My name is Suzanne Owera, and I'm the founder and the CEO of Comfort Center Leicester, and we've been working at least, we're making 2 years this August. I think from my experience, encountering with people living with sickle cell, it's very important that someone is there to, to relate with them and understand where they're coming from. And being that it's affect Black minority, and majority of people who are living with sickle cell are immigrants, and myself being immigrants, I understand how difficult it is to adapt in the system. And Comfort Center is offering one of those key things to support the individual, the families, and the carers to navigate and the system. And to awareness is one of the key things that Comfort Center is really focusing on. I think when it comes to racism, I must say it is there and anyone can experience that. But when it comes to sickle cell, being that is one of the conditions that is not being recognized as a disability, so it makes it really difficult. And not everybody, not health people like nurses, not all of them are aware of the sickle cell and how it affects. When a patient of sickle cell is in crisis and in pain, they would still ask them to wait for their time to see the doctor, which makes it really difficult, because when they're going through pain, only themselves can understand how it feels.
Sickle cell is a lifelong illness with no cure. However, it is manageable. But due to stigmas when it comes to drug overdosing, unfortunately, when they are rushed into the hospital during a pain crisis, their lives are only made worse by the way that they are treated by staff. A hard-hitting report called No One Is Listening was created by local MPs in 2020-21. After the tragic death of Evan Smith, who was a 21-year-old from North London, he was ignored by hospital staff in the height of his pain. At one stage, he rang 999 from his hospital bed, begging for oxygen. The coroner said he would not have died if medical staff had recognised his symptoms and gave him a blood transfusion sooner. The coroner said the fact that Evan called the London Ambulance Service was an indication of how concerned he was. Yet, there was a failure to appreciate the significance of his symptoms by those who were looking after him at the time. The report shows a long list of deaths and near misses of people with sickle cell. It's a distressing report. The MPs reveal a pattern of many years of substandard care, stigmatisation and a lack of prioritisation, which have resulted in sickle cell patients losing trust in the healthcare system that is there to help them. It also says that there is a question of race. There is a number of severe complications that come with having the disease, like extreme pain. People can experience having stroke-like symptoms, vision problems, jaundice, fatigue, joint pain, and acute chest syndrome, and a high risk of infection. Managing sickle cell means lifelong treatment, which is usually in the form of medication supplements, like folic acid and blood transfusions. As far as genetic disorders go, sickle cell is quite common. It predominantly affects people of African descent and across the diaspora. This is a healthy red blood cell. They are round and they flow through the vessels easily. This is a sickle cell. It is stretched out and it is not round. It's shaped like, well, a sickle or a crescent moon, meaning it gets stuck in small vessels and causes a pain crisis. Nigeria has the highest rate of sickle cell in the world. There is an estimate of 150,000 babies being born with the disease. But despite that, there is still a stigma around sickle cell. Statistics show with the amount of people that sickle cell affects, it is up there on the same level as cancer. However, it is a disease that mainly affects Black and brown people, which means many healthcare professionals do not give proper care when patients are made to be seen.
Hiya, I'm Dr. Zain Lehman and I am a junior doctor.
So, Dr. Lehman, How would you describe medical racism?
So I'd probably talk about it, how it affects patients in general. So medical racism is referring to the systemic discrimination based on race within healthcare. So it can lead to impacts in all aspects of patient care. So it can lead to delayed diagnoses, it can lead to delayed access to healthcare services or inadequate treatment. It can lead to bias and discrimination when you're making decisions about patient treatment, and ultimately it leads to poorer health outcomes for patients. And if that patient has sickle cell, then it will lead to poorer outcomes for them with sickle cell.
So sickle cell affects thousands of people across the diaspora, but it is still severely underfunded. Can you tell us why that is?
So historically, sickle cell disease research and funding have not been prioritised, and that's partly due to its prevalence amongst Black people. So if you're looking at the comparison to other genetic disorders, it is less funded and less research has been put into it. In fact, many voluntary organisations had to be started in order to help combat the stigma faced by people with sickle cell, and this eventually led to national screening programmes for babies and so on. And this helped with pushing forward treatment and management of sickle cell disease. So a lot of people would say that, okay, the population of the Black individuals in the UK is smaller in comparison to other minorities or other members of members of the UK population. And that would explain why maybe there's less funding. But I think that as the population of Black individuals and other ethnic minorities continues to grow, we should see this reflected in funding and research for these conditions, because the prevalence of these conditions will be increasing. And similarly, I think that education, so it starts all the way from, the beginnings of who are the people going to be taking care of these individuals, and we need to educate them appropriately in order to be able to diagnose and manage these conditions.
What do you think families can do to help make the pain of sickle cell easier?
So racial biases can result in unnecessary suffering and complications. As I said, poor health outcomes for these patients. So let's say for diagnosing a patient, if you automatically have a lack of knowledge, so you weren't educated properly, it can result in quality of care because actually that patient will have delayed diagnosis. In terms of treatment, we have bias revolving around Black people and their pain tolerances. So a patient might not get the appropriate amount of pain medication because of a bias that somebody has. And again, this can impact management of the condition and of the patient as a whole. And again, I think research is so important because without research and clinical trials, we can't develop and improve management and treatment for these conditions. And racial bias can have an impact or can have a role to play in underfunding in these areas as well. So I think that the first thing anybody could do is work towards identifying unconscious bias. So a lot of progress has been made in terms of equality, diversity and inclusivity training, but there is still a long way to go. And I think it's the responsibility of every healthcare professional to reflect and try to provide impartial and unbiased, unprejudiced care to their patients. And I think in addition to this, healthcare professionals can work towards improving access to comprehensive care. We can advocate for equitable healthcare policies. We can actively listen and validate the experience of the sickle cell patients. Those are some things that we can do.
Are there specific resources or support systems available for patients with sickle cell disease who might be facing racial biases in their medical treatment?
So I can provide you, specific for sickle cell patients and also generally. Patients and families can educate themselves about their own conditions. They can keep proper medical records about things that have happened and things that they've had done, and they can seek second opinions if they need to, and they can join these advocacy groups. But I think lots of people from ethnic backgrounds in particular are scared to complain and report because of how that might impact their current treatment or future treatment, and we're often scared to be called troublemakers. And I think that's something that we need to try to step away from, because I think the more that people complain and the more that people raise awareness for areas that need more education, need more support, need more financial aid, need more research, that is the only way that we can actually improve on what we have now and provide better care and better treatment in the future.
Advocates and sickle cell warriors have been calling for standardised care for years now. Although it is getting better, there is still a lot more work to be done.